Welcome back in. Finding a pediatric primary care provider can be tricky. Where do you start? And where do you look for the one who best matches your kid's needs? Well, joining us today is Dr. Noah Sutter, a pediatrician at Maumee Pediatric Associates, who can help us narrow down that search. Good to see you. Thanks for being here.
Thank you. It's good to be here.
So you are affiliated with Nationwide.
Correct.
So there's a number of doctors even within your practice.
Yeah, we do have several practices in and around town, and we're just moving down to Bowling Green as well. So it's opening soon.
All right. So when we think about a pediatrician, I think a lot of times parents are like, oh, I have a baby now, I need a doctor.
Yes.
But you got to probably think about that before the baby comes.
It does help to think about. I would say the majority of people don't necessarily really plan that much. I mean, you're a real go-getter if you're planning and looking into it hardcore. I think a lot of people go with word of mouth. Who do your friends, your family take their kids to? So I think that's the primary place where people start. But then a lot of times it's just the logistics of it. Where do they accept your insurance? Where is close by where you live? Where can they get people in relatively quickly? So there's several things that when you're thinking about a pediatric office, you want to make sure that all of that stuff lines up, as well as do the providers there, do they fit for your philosophy, your style? What are your priorities for your child for the future? Because hopefully it's going to be a relationship that can span from birth all the way till adulthood. Yeah,
and we think about the little babies, and when they're younger, we're thinking, okay, well they need their shots, or they're sick, they have an ear infection, I don't know what's wrong with them, they can't tell me. And then as they get older, then we start to talk about other issues. So like you said, you want somebody who's going to be able to go with you through this whole process. At what point though maybe you've been with the pediatrician for a while, and maybe things did work in the beginning, but now your kids have different types of needs. How do you know when it's time to maybe say we need to go in a different direction?
And I think going back to the kid, what are you noticing with your child? Do they feel like they can communicate as they get older with the provider? Communication is really the key. So if you feel like you're having trouble communicating with your provider, or there's lapses in care or anything like that, then sometimes it's not a bad idea to look around, maybe in the same practice. Like I see kids that sometimes young ladies are ready to see the girl doctor in the office as they get older. So it just depends, but I kind of go with the kid and what they need, because that's really what we're there for, and what we're trying to support as parents too, that going from little kids into adulthood, and how do we give them the skills to do that? And communication is unfortunately something that kids are having difficulty with these days with all the technology. So if they feel like they can communicate better with their provider, I think that helps everybody.
Yeah, and as they get older, how does mental health become part of the overall health picture too? Because I think when they're younger, we're thinking about physical health.
Right, yeah. There's so many mental health things that we're more aware of these days, and a lot of what we do as pediatric primary care providers is anticipating some of those struggles, whether it's through adolescence or when we change schools. But we do a lot of screening kind of things as preventative health care that can highlight or find some of those conditions, not necessarily so that we have to do anything dramatic, so that we can watch it and make sure that the kids have all the tools that they need as they're going through those challenging periods, to give them some support to be successful adults.
Yeah. Well, how do we know the difference between I need to see my primary care physician versus can I take my kid to urgent care? Is there a point where you want to try to see the pediatrician for everything?
That's a great question. And with people being busy these days, it's really tough on families if the office hours aren't they're during your working hours. So I think urgent cares and ERs are very helpful for certain situations, especially if we're like, is this strep throat, or if it's do we need stitches or a cast or something like that? A lot of times offices aren't doing that. So those are great opportunities to get faster care. But most of the things, even things that you wouldn't necessarily think about, like is this an ear infection, I think the continuity of care with doctors. Like I see some patients that have seen urgent cares in between, because a lot of times as a parent, you know that things will only happen on the weekends or after hours anyways.
Yeah.
But we like to see them in the office so that we can say like, oh yeah, you need to go see an ear, nose, and throat doctor for this, or you've been in the office several times for a cough. Maybe this is allergies or asthma kind of thing. So I think the more continuity of care that you have with that, the better care we can provide for them in the future.
Yeah, that you've got that running list of, okay, you've now seen us 8 times for ear infection in the last year. Yeah, it's time to do something a little bit different. All right, well, if you are looking for a pediatrician, here's some information here about Nationwide Children's Maumee Pediatric Associates. They're in Maumee. A phone number to jot down as well if you're looking for a doctor for your kids. Here's some information. Dr. Sutter, thanks for being here today.
Thank you so much.
Yep.